Okay. Heard myself echoing for those of you who might be online. Welcome to our first day of budget hearings for 2022 for the Douglas County Board of Commissioners. It is July 5th, and I'm just going to turn this over to Sarah to kick us off.
Thank you, commissioners. This is the result of a lot of hard work by a lot of people coming into developing an annual budget process. So as we're real excited to get started here and excited for the commissioners to have a chance to review each of the items. Cammie prepared a PowerPoint here that kind of just has some overview information to sort of set the stage in terms of, you know, revenues and some broad overview themes. So we'll move through it pretty quickly, but please stop me and ask for questions, although I'm going to be turning my head constantly. So we'll just make it work. So, all right. Thanks, Cammie.
Good morning, commissioners. This is the 2023 Douglas County budget overview. Just some high-level information on the budget, starting with revenues. We all know that the sales tax is stabilized and increasing slightly for 2022, and that's reflected in our estimated revenues. The Register of Deeds fees continue to increase with the home sales market, and mortgage refinancing is slowing down, but those filing fees are fees per page, so they continue to come in. The assessed valuation growth overall was 12.44%, bringing an additional ad valorem tax of approximately $7.2 million. The historical growth has typically been around 4.85%. And on this next slide, I made a 10-year history for your information and kind of remind us all of the assessed value growth over the last 10 years. I can tell you that the 2013 and 14 is still rebounding from the 2008 reductions that we saw happen with the economy at that time. So the past 5-year average is 6.09%, and the past 10-year average is 4.46% as far as growth is concerned. And last year, we only had that 2.75 growth. So then we look at some fund balances just to give you an idea of where we ended up. This is very similar information to what you saw at year-end transfers, but it gives you an idea of the percentage of the total fund for each fund balance and what we budgeted versus what we actually came in on. The important ones are the ones that we use operating funds out of. So general fund, road and bridge, those and mental health sales tax, those all have a lot of operations coming out of them, as well as ambulance. But they are not as dependent on a large fund balance as the general fund.
I'd say, you know, I don't have an official fund balance policy or target, but, you know, my goal has been around 20-25%. That's what's recommended by the Government Finance Officers Association. Many organizations go a little bit higher than that. So I'd say 20 is probably the lower end of where some folks are. Just as an outlier, the special building is pretty high. It's a very small fund. As you can see that the fund balance, you know, the budgeted fund balance is pretty small there. That is a fund that we use for capital planning and projects. So, and as commissioners know, we have not prepared a detailed CIP included in the 2023 budget because of working on ARPA. We're going to put that off till fall. So I anticipate that we will come up with projects to how to spend some of that down this fall. Any questions so far? Okay.
This is just a high level slide about the transfers that we have in this year's budget. They're right in line with what we usually do. The ambulance fund is to make up for any amount of taxes that are needed to go above the statutory limit of 3 mils. The capital improvement projects, you've seen that in the budget at 4.9 million. Equipment reserve fund, I totaled these up in the general fund. You don't ever really see this number all as a whole, so I thought that was a good number to share. And then the sales tax fund gets half of all the sales tax that comes into the general fund. So Right now, that is budgeted at $4 million.
Just a little piece of information related to the ambulance fund. So the reason why there's a 3 mil limit on a separate fund, if it was inside the general fund, it would have no limit. It's just kind of a weird quirk of statutes that if you're going to have a separate fund, it can only be 3 mils. So that's why we do the additional transfer over it. I think it's one of our hopes that now that we have a different model for funding LDCFM, we may consolidate some funds this fall to try to, so we wouldn't have to necessarily do this transfer. But we would still cost out like what percent, you'd be able to just more clearly state what part of the mill levy is going to support ambulances. I think, and as Cammie, I think pointed out on the capital improvement projects fund, generally that fund has grown with the rate the budget has grown in our budget. That's generally how we've pegged it. This year, because it was 12.44% growth, we pegged this one at 7. So that growth rate is 7% over what it was the year before. And then the sales tax fund, that 4% being transferred into the fund where we pay off the debt associated, only half stays for operations. So, and that was outlined by the ballot initiative back in 1996. So.
On this slide, we list the supplemental requests that were funded in the proposed budget as you have it in your hands right now. Ambulance, that you can see which capital projects, but capital projects were included at the current 36% split. It's just been historically funded. So it was entered. It's not, you can do with it what you want. Administration included the market merit and longevity that we discussed for all employees. Emergency management, outdoor siren, annual subscription and backup modem, and IT Microsoft 365 licensing. Those are just annual subscriptions that will increase the budget.
We'll talk more about LDCFM when Interim Chief Fagan gets here in that project, but those, is he already here? Yeah, they can come on in if they want. We've just traditionally put in capital. I would say these are some pretty large capital projects, so I am fully anticipating we're gonna have some conversations about those. So.
For the behavioral health committed funds, there were 2 new requests that were used with current behavioral health dollars. And that's the DECA increased SUD treatment for the uninsured, Heartland Radar expansion of the ICC team, and then another DECA in crisis involved youth beds is being spent from behavioral health funds from mental health sales tax, all within the committed funds that were assigned to behavioral health projects. I do have a note that there's an additional commitment that the commissioners have made for mental health sales tax fund of $1.8 million. And while you won't see that in this budget, because we're speaking largely about ad valorem tax, I want you to know that your final budget will represent it.
And these would be one-time commitments associated with, follow-up from your conversations related to ARPA.
And then to round off this overview, I gave you a timeline of dates that are coming up just because I know our calendar's been very full lately. July 12th, these budget hearings and deliberations wrap up in theory. July 20th is a statutory deadline to notify the county clerk of the intent to exceed the revenue neutral rate. This was a new law last year. We did exceed the revenue neutral rate last year, but the revenue neutral rate letters were not sent out by the county clerk as the state allowed for a soft implementation of the law. And so there's a lot more happening this year in this revenue neutral rate area. And so I want to make sure that we say it enough and put it out there enough that you know what we're doing. There is also, and we'll do this on August 24th, but there's also new requirements in order to exceed the revenue neutral rate, including a published roll call vote. where we publish your name and whether you voted yes or no, and we send that into the state with our forms. So there's a lot more paperwork that needs to be followed, and so we'll be talking about this more every time we meet.
And this process, so revenue neutral is if you're $1 over what you had allocated last year, you have to have this hearing and you have to publish this resolution. And this is the same process that every taxing jurisdiction throughout Kansas is going through at this same time. So every cemetery district, every township, are all doing this work to be in compliant with this. And the clerk's office is working very hard right now to try to prepare these notices to mail to all 44,000 parcels in Douglas County. As we get closer to that, clerk's office is going to work with Marnie so folks can have some expectations that they're going to get any piece of mail that they've not traditionally received in the past. And it's not a tax bill, but it's a process that they can learn more about their tax bill. So.
Sarah, this is Commissioner Portillo. Did the state provide any funding for this additional mailing and paperwork and actual labor that has to go into this piece of the budgeting process for all taxing jurisdictions?
Well,
throughout
they
Kansas?
provided no labor, and it actually made it more difficult. They have said that they will reimburse costs for a year, but I don't think they know how much the costs are going to be yet. For us, it's going to involve, we're working with our tax system provider to be able to provide an automated way of generating these letters. And it requires, multiple jurisdictions to enter their revenue neutral rate and when they're going to have their hearing. So included in this letter will be when each of those locations are having their hearings. So if you want to go and attend, you can do so.
And this is the county clerk's office while they're also preparing for
An election.
primary elections.
Yep.
And
They're
Thank
busy.
so that letter should come out by August 10th. I highly suspect it'll be more like August 5th because our clerk's office is really working hard on this, but that's the statutory deadline. So I expect lots of questions when those letters hit taxpayers' mailboxes. August 14th is the date that we're planning to put our Douglas County hearing notices in the paper, both R&R and budget. And August 24th is when we anticipate adopting the 2023 budget with the commission. And then in September, we'll see you for the CIP budget process. And that's all I have. Do you have questions?
This is Commissioner Reed. I don't have any questions, but appreciate the overview. Any questions from other commissioners?
Just to make sure on the revenue neutral rate letter of intent, it isn't going to encompass all of their taxing districts in one letter.
Yes.
I want to make sure the public doesn't think they're going to get multiple letters for
Yep.
each taxing district.
Which leads to some of the complexity of putting it together. I think there's one piece of the schools that's left out, like the state levy is not included, but most folks will have multiple lines that will show each of their taxing jurisdictions.
So did you just say that what the state is levying is not part of the revenue? neutral?
You're correct.
Yeah.
It
The
is.
state
it
is very concerned about local jurisdictions, but not
they-
their
they-
own taxing authority.
Making that point, that's all.
It will be listed on the letter, but they are exempt from revenue neutral restrictions
And a hearing.
and hearing, all of the above.
It's been quite the ordeal. Okay. Well, we could keep moving ahead of schedule if you want. Folks from LDCFM are here. If you want to go ahead and
Sounds
move
great.
forward.
Do you want me to
Cami-
give this handout on it?
Yeah, Cami has a handout to pass around. Once you guys come on up. Would it be, you can pull chairs up, and squeeze in with a little kid table with us if you want. Yeah. And do we want one more mic? Do we have an extra microphone, Dana? Okay, yeah, if we could have one more, that'd be great. Yeah, give it to Mackenzie. Great. Yeah, great. You can just go ahead and pass them out if you want while we're in hold. You look like a little halo around your head. The light.
We're gonna have to shut the window. He can't have a halo.
You need one more? You go, Tammy? Okay. I think Cammie's gonna start us off by walking through from that. So, and maybe while she's getting situated to do that, I want to thank Chief Fagan and Chief Joels and Mackenzie for being here to help walk through this, but it's a very complex operation that we have here in terms of preparing a budget for LDCFM, both between the city and the county. And I think the timelines associated with how we put budgets together really makes life difficult for this team as they're coming together. Our process runs a little ahead of the cities. So, I'm sure they're trying to get information together probably a little faster than some folks. I mean, then it's just not on the same timeline at the city. So, I receive most of the LDCFM information about a week or two before our proposed budget is done. So it is probably one of the pieces that I have the least amount of time to get, if we need, that's why you're getting information today as opposed to information that may have been in the book when you received it. So, we just do our best to kind of work our way through it. So with that, Tammy, do you want to walk us through what you put
Handout?
together the handout?
Yeah, what you have in front of you is a handout, and it's just a very simplified, I call it a cheat sheet of the shift of cover changes that will happen if there's an expansion. As you know, we currently pay 36% of the LDCFM items, and that would be changed to 39% with the expansion of the ambulance. So this just gives a very high level. There's a lot more to it, but total budget for Douglas County with the 36% versus total budget to Douglas County for the ambulance with the new 39%. So you just get the difference right there of $478,000. And then the 9 FTEs, that would be the county portion at $347.51 that would be needed for the new ambulance. And then of course the additional vehicle is $450,000 for a full cost difference of $1.2 million. And if you look down below, the summaries are extracted straight out of the spreadsheets that you have back in your trends and analysis section of your budget book. And it shows you without expansion and with expansion as far as the split and the totals go.
Any questions on that? Any questions on that? Before we turn it over to Chief Fagan?
This Commissioner Reed, I think my only question about it is to just want to kind of make sure that I'm tracking right I guess my concern is how much more our share may continue to grow over time. And so I just want to kind of hear from staff or from the chiefs if, the sort of group of requests this time and these the additional capital project, the additional staff, is it something that you anticipate will, I suppose, increase capacity for some longevity in the department? Or are you anticipating that that you will need to continue to gradually increase capacity, if that makes sense? I'm just wondering if, 36 up to 39 keeps growing by a few percentage points, and that share cost in a matter of years shifts significantly. So I'm just curious what your thoughts are on that.
Oh, thank you. Got it. Well, again, thank you, Sarah, for comments in relation to the team building the budget, you're absolutely right. There is a lot to this. And definitely understand the complexities of the 36 to 39%. So what this is essentially, this ambulance is the moving forward of the expansion ambulance that will come in the future towards new fire stations, fire medical stations in the future within the city of Lawrence. What we found in our data is that we need an ambulance immediately. We have a facility where we can station that ambulance now. And so when that station is built and is operational, which we're advocating, it's in the capital proposals today, there will be an expansion fire apparatus, which will again shift that percentage back down. But over time, this will be continuously evolving, shifting back and forward. We have also identified station number 7, which will need an ambulance and a fire apparatus as well. And so again, that percentage will continue to shift back and forward as we move forward towards our evolution as a department. But to answer your question very specifically, this is a 3% move that will adjust back down a little bit with the expansion of the fire medical station 6, with the addition of the fire apparatus at that time. And then at that time, as we continue to monitor our needs, that's I guess what I would say is the beauty or the art of this model, this cost share model, is that it's based on the ratio. And so as that continues to evolve, the cost share is representative of that. And that was a challenge for our team when we went through the agreement process last year when we worked through the consultant, and but it's based on the recommendation from that team, the most fair way to approach the cost share.
Thank you, Chief.
So maybe I'm digging in too fast here. So let me know if you're going to cover this later. You say we need an ambulance right now. Does your data show that we don't need a fire or apparatus right now?
But we do as well. And we have requested for that through the capital process. The challenge for that is that we don't have a facility to deploy it out of. And so that is a part of our proposal with the city, and we're moving towards those solutions. But we do have a facility to locate the ambulance in right now, and actually a very strategic location based on density. And so we can deploy that ambulance in 2023 as soon as we get the staffing for it, using a reserve ambulance until we can get that asset purchased and immediately start making that impact on the service level to the community. It's our recommendation, absolutely, that we do need additional fire apparatus. As you may have seen in our last presentation just a few weeks ago, we've got service gaps, not just for EMS, but fire protection as well. And again, we're a single service fire-based EMS system. And so when we look at our gaps, we want to make sure that we're tackling those gaps based on all risk.
Thanks.
It'd be my pleasure. So we have a few things here, and I know that there's quite a bit. The first sheet is, and you'll see that table that's at the top, the total incident count is showing the table that we showed you a few weeks ago, which is showing what's happening within the community in this rapid escalation of calls that we're experiencing of the last 2 years. And that 24% increase from 2020 to 22 projected, and the 22 numbers projected, and that's based on the moving daily average of the last 180 days. And so this is a pretty significant impact to our service delivery and the quality response times and outcomes. And so one of the questions that came from that presentation was the call distribution. What is the ratio and what may be driving that? And so what we've got there is we're showing that percentage and ratio over time. And you can see it's held with the increasing call volume. You can see that ratio is fairly proportionate all along the way. But as you continue to, what I'll just describe as pull back layers of the onion. The next page, I'm going to put that on in the parking lot for a minute, the non-emergency transports. But these two sheets here really get into the detail of 2021 and 2022 year to date. And you'll see these two side by side. And I've highlighted the section. So the one that's highlighted in yellow is for 2021 year, all the way through the year. In 2022, that is January 1st through yesterday. So pretty up to date data. And so I've highlighted, and what this does is this extrapolates all the different call types that we do across our service based on percentages. And so you can see the percentage by month and the percentage through the entire year. But one of the comments that we shared with you, because one of the questions I think you had, Commissioner Kelly, was what's driving that increase in that 24%? Is it an increase of fires? Is it an increase in medical calls? And what we shared with you at that time was that it's actually about the same. I mean, it's very minimally different. Throughout all of 2021, that percentage was 62.8% EMS calls. And as we're looking at the first, essentially through the first 5 months of 2022, it's 62.6% EMS. And all the different other call types are in here. There's another report behind this that shows it by counts and not just percentages. And so that gives you a little bit of further intel to show you that extrapolation. So I wanted to make sure that we brought that data to you, Commissioner Kelly, because I know that was one thing you were wanting to see. And then the other data that we wanted to bring to you today was the transfer data. And so we brought that report for the last 3 years, and that's the second sheet, which shows LDCFM non-emergency transports. And this includes transfers from LMH to a lower level of care or from hospital to hospital. And you can see about how many of those there are a year.
What does that break out to roughly, like per day? Or is that, I mean, are you able to articulate what those 761 non-emergency transports relate to in terms of having an ambulance on the street?
Well, so our standards of cover, so our ambulances, right, that we have deployed throughout Douglas County, we utilize those resources to perform that transfer. And so that's not a resource that currently exists to perform that specifically, other than utilizing the ambulances that are on the street. And so, yes, this absolutely impacts our standards of cover. When these happen, we're taking an emergency asset. And that's one of the things we've been communicating, is that we've got to evolve out of our model that was built in the 90s into the next great version of LDCFM. And the challenge as we're doing that is that we've got to evolve to make sure that we're maintaining emergency services well, and while also trying to get out in front of some of the things like community risk reduction, some of the non-emergency services like this, which impact the emergency service quality that we have today, because those are primarily the resources that we have. So it's a little bit of a two-part challenge, is that we want to maintain high quality emergency services, while also we need to bolster community risk reduction in a different way, to where we aren't having to rely upon emergency assets to do that work as well.
This is Commissioner Portillo. I really appreciate that, and I have a couple questions on it. The first is that a couple weeks ago, we had a presentation on Project Lively, and that was really meant to reduce the number of high frequency callers. So how do you see that as potentially impacting these numbers? And then the second piece of that is that I know a lot of fire departments, particularly in the KC metro area, have mobile integrated health through their fire departments. That's not something that we have here locally, but that could be another thing that could reduce some of the non-emergency use of our medical assets, which could potentially free things up as well. Could you just speak to that a bit for us?
Of course. So I'll set this up, but I want to make sure that I give my team an opportunity to talk about mobile integrated health as well. But community risk reduction is a very broad umbrella of things that would reduce risk within the community. That would include bolstering public education. The fire marshal's office would be underneath community risk reduction, but just one segment of it. But that's not just community risk reduction. It's more broad than that. So MIH is a tremendous opportunity that we're really hoping for, that we can move towards in Douglas County, because we've seen the data. There is no shortage of data on MIH, whether it's through Project Lively or some of the data that we have within LDCFM. And we know that there would be a tremendous impact here. But whether, where that falls, if it's under the fire department in one community or the ambulance service in another community, or how that falls, I can't speak to, how those arrangements are determined within those communities. I know it happens in different ways all over the country. But what we're ready for is to move forward and take action to make a difference. And we need to. The rate at which our calls are increasing is just not sustainable to continue to throw emergency assets at it, because although those are needed, we also need to get something out front there that is going to temper that increasing rate of calls. But in regards to specific data on high utilizers of our system, we do have situations today where there are utilizers that use our services up to 60 times in a year plus. And so they don't need an ambulance. They need more definitive solutions that are alternative to what we can provide. And they need to be connected with those resources. But we are the interface there. When they don't have anywhere else to go, they call 911 and we're there, and we will always be there. But we need to connect them in a different way to where they are not burdened with those bills, whether it's through us or through the hospital system, and they're connected with resources in a different way to get them help that they really need. But Division Chief Joels, did you want to provide some additional insight on MIH?
Yeah, Mr. Chief Joel, to answer your question about the impact that mobile integrated health can have in the county, we don't know because we've not gone down that path. We do know that Project Lively is only, they're at capacity with their personnel on which, how many patients or customers they can handle at a time. They've already met that limit. In addition to that, we won't know what mobile integrated health can have as an impact, other than I can tell you, I guarantee that it will have an impact until we know what our partner will be. If it's 2 paramedics, we can have an impact. It's hard to call 2 paramedics mobile integrated health. You'd probably call that community paramedicine. If it's mobile integrated health with a paramedic and a social worker, that will serve one part of the community. It could be a nurse practitioner and a paramedic. It just depends on what we are partnering with. The impact will be there. There are many agencies across the country that have mobile integrated health that don't measure anything. I don't think that will probably be where we are here, and that's fine because we're used to that. We see with the papers in front of us. We will have a nearly immediate impact with the community that we serve with the mobile integrated health program. We've been talking about this for nearly 5 years. This is not new to us.
So you don't have a model yet in terms of
We have
partnership?
we have a model.
Or
The
one
one that we had, in 2019 with the hospital, with the pandemic, they lost a lot of their nurse practitioners. As we've grown to learn more about the model and approach that we take, I'm not so sure that a nurse practitioner or a mid-level provider is the only solution. I think a social worker could be an alternate solution. And we have plenty of, I shouldn't say plenty because we don't have plenty. We have social workers within our county and our community that we could probably partner with fairly easily on a weekly 40-hour basis, 50-hour basis, depending on who we are able to partner with.
that this would be additional, I mean, you'd be asking more of that social worker than what they're currently doing, correct? So you'd be asking in essence for that organization to bring a new resource on board, right?
Unless there's somebody who has the
Capacity.
ability to have that capacity already that we can help them help us, and it just would be symbiotic. We would be able to, there are plenty of organizations we have conversations with that want to do something. We just don't have the backing.
This Commissioner, Commissioner Reed, I heard you say, Chief Fagan, that there's a number of models and ways that mobile integrated health looks like in terms of different communities. Are you guys personally aware of, I know Douglas County is a bit unique with the EMS and fire combined. Do you know of other communities with a similar model to that mobile integrated health is really a part of both fire and EMS services, or traditionally in your experience, are they? I'm aware of them, as Commissioner Portillo mentioned, being integrated with some fire departments in particular, but curious if you all can speak to that. And then one other follow-up question I had was the non-emergency transports. In other communities, are you aware that I guess, is it typical in your knowledge that hospitals and medical facilities provide some sort of non-emergency transport for between facilities back home or to like rehabilitation facilities after hospitals. Can you speak to some of that? If it's typical for the local EMS and fire department to be doing those transports?
I'll answer the transports question, then we can go back to the MIH. It happens in several ways across the country. Hospitals, there are some communities in which the hospital system is the EMS provider. So it really happens in numerous ways all over the country. I've been in another community where there was a third or a second party that would do the non-emergency services transports. That would be something that we could explore moving forward into the future. There would be an impact to revenue because that would be revenue that would not be collected back to the county. But that is something that we could absolutely explore as we're evolving into the future. Currently, it is established by ordinance that LDCFM is the ambulance provider in Douglas County unless we authorize based on resource availability and other service to come in to provide that service. Division Chief Joels, if you wanted to speak to the MIH question.
Division Chief Joels. So locally, one of the closest would be Central Jackson County Fire Protection District, which is Blue Springs, Missouri. They have a successful mobile integrated health program that is run, and they run the ambulance and the fire department. There are numerous across the country that we could get you as much information as you want, more than just these pieces of paper. So that I am on a monthly meeting for mobile integrated health through the NAEMSP, which is Emergency Medical Physicians Medical Directors Group that I sit on every single month. So the knowledge is there. We have plenty of models to go off of. We just need the staff and the opportunity.
And I really think it's about, this conversation is really about governance and financing, in those models where you have combined fire EMS transport, like we figured this out when we went through the Wichita State process. Everybody does it differently in terms of that. I think what is concerning to me is just that with us having a model where we do have a shared expense model, that this clearly has a shared benefit to both the fire and the EMS system. And so to me, it logically belongs in a shared column. But the model as to how it would work, how it be implemented is, really, I don't even really want to call it cutting edge anymore. I mean, most communities are doing something like this. So I think it's an important addition. The question is just, how is it paid for?
Division Chief Scholes again. I think it's good to note that I don't know that we have the data, and if we don't, we can certainly get it. But we have the money. We have the ability to show what some of our customers are not paying as far as their bills, and it far exceeds what it would cost our LDCFM to run the program, and that's money just left that we're not getting because we're not collecting. However, those are still patients that we could impact to cut that completely out if we connect them to the right resources. Douglas County has the right resources. Connecting them in an emergency vehicle response is not the way to do it. We are not often, but we sometimes find ourselves going from call to call to call, and we're going from a non-emergency call, trying to wrap that up to go to an emergency call, and we find ourselves doing that. So the money far exceeds, we're not getting paid back by hundreds of our customers yearly. It's money left.
This is Commissioner Portillo. I just want to be clear, though. A lot of that is, those are patients in our community who may not have the funding to pay for it. So this isn't people just choosing not to pay. This is often the most vulnerable members of our community who need access to resources, who may not have the money to pay. But it would cost us less as a community to invest in some sort of preventative care, risk reduction, because we wouldn't be then spending money that we know we'll never recoup. This isn't a collections issue. The money isn't there.
The service exists for emergency services, and we will absolutely respond to the best of our ability 24/7, 365, anytime we're called. And so I think what Division Chief Jones was referring to is that in regards to it, whoever is providing the non-emergency or the emergency service, as we move forward, there is a segment of the, community for the services that we're providing, and we're always providing it. On the back end, the financial piece it just is what it is. On the evolution of that, we do work very closely with our community to make payment plan arrangements to where we understand there may be situations to where they may not be able to pay the whole bill at that time. So work very closely with our customers in that space. I want to come back to data real quick. There is no shortage of data. And we've shown that data, and I think there's other groups in the community that have shown that data as well. When we've talked to some of our peers in the metro and even some agencies across the country, what we've found is that whatever resources that you can put towards this space, they're going to be inundated. And there is great things that happen there. But this is a tremendous need, not just in Lawrence, but across the entire country. And a lot of communities are stepping forward, maybe even in the absence of data. We've got data. We're ready to step forward. The challenge is just getting the resources in place to allow us to do so.
I guess that's a good segue into my question, which is a similar question to the question I asked last year at this time, is with the data that you have, and it sounds like for 5 years you've been working on, integrated health. This is my 4th budget hearing, and I've yet to hear here's how we're using services. Here's a creative way we have of using services differently that's going to lower our cost. And so when I look at non-emergency transports, it seems like the LDCFM would have an interest in saying, what might be a way we could do this differently that would save us dollars in the end? Because it's expensive to send emergency assets out on a non-emergency call. But mostly what I'm hearing is, well, we need more resources and we need more dollars. Do you guys spend any time thinking about how to lower those costs? What's a better way to do this that might not be the same cost?
Yes. The challenge that we're facing is that we have emergency service gaps today. And so as we look towards the future to try to get out in front of it, it's a two-headed approach. We've got to have the services to make sure that we're able to provide the emergency services while at the same time reducing. So the bottom line is that we don't have the standards of cover today that we need based on the service level the community has expected over the last decade or so. And so that's, as we're moving towards that, we recognize that we can't just fix that. We've got to do this differently as we move into the future, because if we don't, the rate of increase is not sustainable. If we can get out in front of ahead of it, we can reduce the amount of calls or at least stabilize it. I don't know that we'll be able to actually reduce it, but we believe we can stabilize it through more community risk reduction in a much stronger way than we have in the past. And community risk reduction absolutely includes mobile integrated health. It is something that there's a data sharing collaborative. I'm sure you all know a lot about that. Again, no shortage of data. It's the resources. And I know that there are resources that are being stood up in other spaces in Douglas County that are fantastic. I think there's opportunities to do some really great things here. And we just need to have that interface connection on the emergency services side with the EMS program to be able to connect those dots better.
And just to follow up on what Commissioner Kelly said, though, Chief, I don't know that we have that luxury. I don't know that we're going to have the luxury to, between the ask here for additional EMS service and what would be on the city side in terms of an expansion of fire service. I don't know that we have the luxury to say, let's get back to standards of cover and then be creative. I think we're going to have to look a little harder at how do we do it? How do we do this as we're doing it? Are there other models besides 9 FTE in an ambulance to help serve the community? And how can we do, and it's a yes and conversation in many cases. I don't think we're saying like in lieu of an ambulance, but how and we've just even talked about, like, for rural residents, trying to get an ambulance over long distances in a short period of time. Are there creative ideas? Are there alternative service delivery models? And I think it would help this commission to know that, like, what you're exploring in that regard. And if you rule it out because it doesn't make sense, then just tell us that. But I think it's, I just think that's something that we're going to have to continue to talk about.
Yes, Sarah, that's what I was getting at. And so like as a commissioner, I would love to see I would love to see what work your group is doing to look at these non-emergency transports and say, yeah, this isn't the best use of our services. This is how we could solve this problem. We could contract this out. We could work with, and when you're looking at mobile integrated health, how can we, part of the power of our commission is that we can convene people, right? And we can bring partners together. So when we're looking at our rural fire district and saying, is there a way we could do non-emergency transfers with rural fire where they're not needing it right now with the resources that they have? Or is it Bert Nash, or is it the hospital? We had some tremendous partnerships that were developed during the pandemic. Let's take advantage of that, how we're talking together. And do our data systems talk? Maybe, maybe not. Maybe we need to work on that. I know that that's been a concern. You shared that before, but I think we have to push in as much of a way of looking collaboratively, because we cannot, as you said, we cannot sustain this continual increase of use of services. I mean, a 25% increase, and I'll say, I think the numbers we're overcompensating for the dip that happened during the pandemic. There's that dip in 2020, and then it jumps to 21 and 24. But I think if you just look at a 2-year window, I think we have to look at ways that we can partner together to provide better service that isn't just extending more and adding more and adding more.
Yes, I'd like to add to that. There's a few conversations that are very early. And I don't want to get out too in front of ourselves, but these are opportunities that happen in other areas of the country. The use of public transit systems. The city of Lawrence is building their transit system in a very robust way. It's very exciting. We've had some preliminary conversations about opportunities there. There may be opportunities in other areas of the county as well to assist for non-emergency transports that would not need an ambulance. But right now, that is the system that's in place. As we move into the future, that is an example of an alternative. Third-party ambulance service is another one. Absolutely. We've got to work through that to move through the systems that are currently in place. And when I say that, the ordinances that are in place to move that, and that's a governance question as we move forward. And I'm glad that we have that arrangement in place to where the city and the county can get together to talk about those things. But absolutely, those are being explored. I think the transit opportunity is a tremendous one. We'll need to talk about what we potentially expect the revenue implications to be there, but it may not be as significant as the value that would be on the backside for sure. The other great possibility is a third-party ambulance service. I've been in a community where that worked. I worked really well, but right now, based on the resources that we have, right now their priority is emergency services, and very often, unfortunately, it's the non-emergency services that are impacting our emergency service capabilities.
Just to piggyback on that, I think one of the systems in place that Chief Fagan is speaking about is the labor management agreement to also restricts that. So, and I want to be really clear if anyone's listening, I'm talking about non-emergency transport, not emergency transport. So if we were talking about a third-party ambulance, it would simply be for non-emergency hospital transports to and from is kind of one of those areas that we explored, and it was mentioned in the Wichita State report, but there would be things to work through if that were to happen.
But it's absolutely possible.
Yeah, it's doable.
Absolutely.
I think this is Commissioner Portillo. I just want to get back to Commissioner Kelly's kind of original question, which sounded to me like we hear that we have an abundance of data, which is great. This is a good problem to have. What are the next steps and priorities? Because as Sarah mentioned, it's not realistic for us to keep expanding services and then in addition fund resources to try alternatives like mobile integrated health and things like that. So how do we, as we're thinking about this from a finance and governance perspective, how do we prioritize working on both of these things at the same time, knowing we don't have resources for all of it?
I would say that the service level historically needs to be a hard conversation. And I know we had in our governance meeting this spring, that was something that we brought forward. Recognizing the increase of the demand on services, the service level is something that would need to be in question as we evolve to address the evolution of the community and the service demands. But I think, again, as with the no shortage of data, that's the great intelligence to make sure that we're making data-informed decisions on our service capabilities and capacities. And so we're actually in a great position based on having this information to where we can see the challenges that we're facing. So as much as it seems like a challenge, it's actually a tremendous opportunity to make some great decisions to make sure that we're maintaining service levels, or if we need to change the service level based on what's happening within the system, that conversation is had as well. But I think on the mobile integrated health side or the community risk reduction side, that's something we've got to build. And Chief Joels and I talk fairly frequently about if we just had something, it's going to be, the opportunity there is tremendous that we can make an impact. But it's that balance of doing that while also making sure that we're maintaining the emergency service capabilities that we need to be able to provide now. And so it is a tough balance, but I think it's a difficult decision, on how we move forward. But the service level is absolutely something that we want to make sure that we're maintaining the service level that our community has told us that they want through our strategic planning process. And that's why you're receiving the recommendations that you've received. And that's a conversation between the city and the county, both on how we move forward relative to that.
Do you want to walk us through any of your other supplemental requests before we
Yes.
wrap up with you all?
We can go through them. So this would be, and if you have the transmittal memo,
Your packet under trends.
Okay.
Is it another trend? No. Okay, yeah. I think that one.
and unfortunately, we don't have page numbers on them, but this will be I'll start on the 4th page. And so the first request was for the expansion ambulance, the expedited ambulance expansion in 2023. This is essentially the staffing that would be needed to get that additional ambulance in the system 24/7, 365. And so this was something that's identified. We do have gaps within the city based on the study that was completed in 2020. And again, the 24% increase is since that time in call volume. So this is something we see that can make an immediate impact within the county. So I think you're well aware of that one. On the next page, we do have a few other positions here. One of them as a public educator position. This is something that would be completely different in the way of providing a portion of community risk reduction, right? This is somebody that would be dedicated to providing education to our community and training in regards to bystander CPR. Right now, our primary tactic for educating our community is through social media. We do have a public education team, but they are firefighter paramedics that work in operations. And, the call volume has gotten so great to where the only way to utilize them effectively to dedicate them to public education is through overtime. And so as we're moving into the future, this new model would include a full-time public educator that would be focused on everything that we do to reduce risk in our community through education. The next position is a captain of EMS and a logistics civilian in EMS. And Division Chief Joels, I wanted you to speak about these two positions specifically within your division.
Division Chief Joel. So currently, it's an EMS division of 1. This is the busiest division in the department, being EMS. So we supply our own EMS supplies. We do all the orderings of the ambulances, do all the data mining for along with Mackenzie, of course, data mining for the EMS calls. The only person in the EMS division is myself. And in order to be able to effectively do administrative tasks, I need some help. And there's not very many divisions of EMS that run this capacity of calls that are the division of one. It impacts my daily ability to do really anything effective administratively, unless I'm doing it off of, over work hours at home. I spent a good hour this morning after our meeting, putting supplies in buckets so that they can get taken to fire stations. And I don't think that's an effective use of my time. I obviously, I'm not saying I'm beneath that. That's not what I'm saying. What I'm saying is that there are requests from commissioners to do stuff that is high level, and I don't have the time to do that because I'm doing things that I would hope that somebody else would have the ability to do, as well as attending high level meetings that there can be more than one person like me representing the fire department and the EMS service here in the county. So having somebody to have the ability to oversee protocols, administrative tasks, go to meetings, be able to be in the community as an aid to training as well, would have a high impact for not only the department, but for the community and the citizens.
I would add to that, as he was sharing, we provide support across many divisions in order to support Chief Joel's and the work that he's doing. And we do need to get him some help in that space. When you think of a countywide EMS provision, equipping all of our first responder partners with all of the EMS equipment that they need, it's a logistics challenge. Currently, we do not have any logistics support for that function.
Quick
So,
question on
yes.
that. Sorry to interrupt you. You said you're a department of one.
Division.
Division of one. The other divisions, how many are there? I mean, so if we look at fire, how many divisions are there in fire?
So division wise in the administration, there's the community risk reduction, which is fire marshal. He's got a captain and a lieutenant. Training chief has a captain and a lieutenant. And then the administration has several administrative employees within the administrative building. You can.
So for the divisions within LDCFM,
Yeah.
we have our operations division, prevention, EMS, admin, and training. Did I
Yeah.
miss any? And operations does not have any administrative staff. They rely on the admin division. Training and prevention both have a captain and lieutenants underneath those. The EMS division is the only one without any employees to support that function. So there's not like a specific fire division.
Okay, it's just interesting to me that based on your call volumes, that you've put so much energy on one side of that ledger versus EMS. I mean, that's what I'm trying to figure out is like, why?
I can
Why do
answer
we do
that.
it that way?
It's not intended to be polarized in that way. Again, we are a system organizationally, but there are very specific tasks such as protocols, very large concentration of need administratively within EMS, whether it's connection with the state board of EMS, other jurisdictions around us, our medical director. There's a lot there in that space. But I would say that it's not intended to be polarized in that way. We want to go the opposite way.
And so are there any of those captain's salary that are 100% city because it's just fire?
That's correct. There
Okay.
are, the fire marshal's office, for example.
Okay.
Primarily focused on the code enforcement side, planning review for the fire code. They are 100% funded by the city. Yes, the training division is shared because they provide training on both everything that we do, not just EMS or fire, but again, it's not polarized in that way. They do technical rescue, hazardous materials, numerous things. Administration is overarchingly support of all of our provision, but our EMS division specifically is Division Chief Joel's. And then we have our EMS billing staff that work with him for accounts receivable functions for the ambulance service.
I guess that's I think it's just one of those things in terms of governance though, is like, why is there a piece of this that should just be part of like operations? Why is it a separate, if it's shared in terms of operations, why is it viewed separately? I don't know that you need to answer that right now, but I think that's something that we're going to continue to kind of press on is that, inside the operations division, you have captains and you've got lieutenants. My assumption is they do a little bit of EMS too. They better, I hope, right?
Yes, and they're in the cost share.
Yeah. And then
Yes.
they're in the shared column.
Yes.
Right.
This is Mackenzie. I will note the delineation of clinical for the position that Chief Joels is talking about. So even though we have administrative staff and he had mentioned administrative tasks, more on the clinical side. So the admin division isn't able to do everything that this position would be doing.
Lastly, I would add that I've been looking forward to this budget process for quite some time. I think one of the things that sets this process up different than the last 4 years that I've been here is we do have a new governance agreement in place. And that was really meant to help us set the stage in a more consistent way. I understand that there will continue to be challenges as we evolve through that, but yeah, I'm looking forward to how our provision continues to evolve to provide great services to our community. We're very proud of our workforce and the great work that they do. But we are facing real challenges as many other organizations are in the city and the county. And I look forward to continuing to move forward to provide the great service that we do.
This is Commissioner Reed. I don't have any other questions. Last call for questions from commissioners. Okay, well, thank you all so much for your time this morning. We appreciate it. Have a
Great,
good
thank
rest of
you.
your day.
Thanks, guys. Just while LDCFM is packing up, just a reminder, commissioners, on your worksheet decisions, we have included capital costs associated with this expansion. If we're not going to add the staff, we could probably reduce those. So, and if you have specific questions, let me know and we can talk through it. Thanks, guys. Good to see you. Yeah, and nice of a lovely community member looking pretty casual over there attending today for us too as well. So it's good to see you, Chief Coffee. We have other members of our emergency services team, emergency management, emergency communications center, and Consolidated Fire District 1 here. We don't really have prepared presentations for each of them. There were no supplemental requests, but they're here if you have any questions. So I just want to make sure we have an opportunity if commissioners have questions on any of those proposals.
We did have a supplemental request from emergency management, right?
I built those two in.
Right,
But yeah,
okay,
if you want to,
yeah.
I'm sure Robert and Jillian would love to come talk about outdoor sirens.
I would actually like to hear from Chief Baxter since he's here.
Come on
If
up.
you were including that in this group.
Yeah, come on up, Chief.
Come on up, Chief. So if it's okay, commissioners, I just have a couple of questions that came up at our last, at the presentation that was done with LDCFM. And it was about service calls in the unincorporated area. And the statement was made that oftentimes Fire District 1 arrives before LDCFM arrives, and that may impact their coverage rates. Can you talk to us a little bit about how you're working with LDCFM, a little bit maybe on data and sharing, and is there a potential for partnership there?
Good morning, Commissioners. Mike Baxter, Fire Chief for Consolidated Fire District 1. Yes, Commissioner Kelly, we collect probably the same, I'm not going to say the same data that LDCFM collects, but as I've shared with the County Administrator, Sarah, just in the past couple of weeks, we collect a lot of data for our district. So everything from turnout time, which is from the time that the call was received in dispatch to the time that they toned us out for the call, to the time that my guys get in the truck, to the time that they get on scene, to the time they clear. So everything is segmented out, and then we can broaden it however direction we want. I have spoken with Lawrence Douglas County Fire Medical in the past, specifically about a year ago, just in reference to the new model that was being delivered with how we were being dispatched out. So that was great initiative between LDCFM and ECC to create that model that did get us spun out quicker. I do have that data as far as when we've arrived on scene versus when the ambulance. Matter of fact, I even tracked the ambulance times. So they're included into our data. So that information is there at this time. There was no request when asked if they would like that information. They did not want to have it at that time. So it's there if they want it, but they just don't want it yet.
And Chief and I have talked about, I think this fall be an opportunity as Chief's kind of got a year, almost two under his belt. To talk about how we can integrate, or how we, it may not quite be apples to apples in every situation, but I think we could get a sense of how quickly folks are responding and how that overlays with ambulances. So I think that's a good project for us to continue to work on, to get a sense of that stuff. And I know Emergency Communication Center has got good information too, and data in terms of that as well, in terms of how quickly folks respond.
Yeah, I appreciate you answering that question, Chief Baxter. I didn't mean to put you on the spot. I just, as we look at some of those zones of coverage that LDCFM has identified, I have an interest in trying to develop better partnerships and more collaboration so we can address some of those gaps. They're asking for a new fire station. I know in one of those zones, we have our rural fire station there. Yeah, I don't know that there's anything there, but I want to make sure that we're working together and that we're talking together and we're collaborating in ways that may provide opportunities for us. So I appreciate it. Looks like you have a response to that.
I will share, Commissioner Kelly, is that our data is a little bit different. And I think that was mentioned during that last commission meeting. Being a mainly volunteer department, it's hard for us to have standards to say you have to do X, Y, and Z, because I don't know where they're coming from. But what I can say is that we look at that information the same way that Lawrence Douglas County Fire Medical does. So we put out those times, and LDCFM says 10 minutes. So I look at that model as well to see where we're strong or where we're weak at. As I shared with Sarah a week or two ago during one of our department head meetings, I just ran the numbers for 2021 combined, and then up to this date. Our average response time from the time that we are notified until the time we arrive on scene throughout the entire district of Consolidated Fire District 1 is 9 minutes and 56 seconds. So we're at that 10-minute mark on average. We have some that are longer, we have some that are shorter, obviously, but when you got to go to mile marker 189 on I-70, that's a long ways from anywhere. So we do have that data. Anytime that the commissioners would like to see anything, or if you have specific questions, I can try to pull that for you.
Great, thanks, and congratulations on being under 10. That's super. I know that you don't necessarily have those, that LDCFM works towards a certain accreditation model, and there is value in that, but I know that there's not the same model for rural, and so I appreciate you at least taking their accreditation model and seeing how it would apply. So thank you.
Any other questions for Chief Baxter?
No questions. Thanks for joining us, Chief.
Thanks. Want to come up and talk about sirens real quick, or no? Any
I don't have any questions.
I don't have any questions.
You're
for you, but
welcome
Thanks for
to
coming.
share with us what you'd like.
If not, we could have a quick break before the sheriff gets here at 10:30, if that would work for folks. So we'll,
Sounds good.
okay.
Thanks for coming, y'all. Thank you, everybody, for the break. As Commissioner Reed, it is 10:30 on the dot, and I see Under Sheriff Stacy Simmons is at the computer and ready to give us a presentation. So I'll turn it over to you.
Is that where you want to start, Sheriff? You have to turn your microphone on.
Is this how we're gonna start
Yeah.
this?
Just on and off.
Okay, so average daily population, obviously, if we were to go back one more year of 16, things would be a little bit weird, but I think that the 17 shows us a good kind of a starting point for what we are currently dealing with as well. So obviously 2020 numbers in 2021 are post-COVID, or actually during COVID, post-COVID. And we obviously the courts, I believe, gave us a reprieve and kicked a lot of people out of jail that didn't need to be in jail. But what I would say to anybody who will listen is that 153 and 141 are the people who needed to remain in jail. They were vetted and they were deemed to not be able to be outside of our facility at that time. So while our population appears to have dropped, the intensity and severity of our inmate population, as well as the crimes that they're being held for, has steadily inclined. It's a kind of a tough number to calculate and show, but what's the next slide? Yes, so this is kind of our best way, because in order to show like severity of crimes, we would really have to get into a lot of the court data and charging and that kind of stuff, and it gets a little bit. But what we can show you is our officers' need of assistance calls. Basically, if we have inmates who are fighting with each other, fighting with staff, refusing to lock down or do as told, you can clearly see just a spike. And we're on pace for 2022 to exceed the number of 130 as well. And so hopefully this number kind of demonstrates the nature of our current jail population, as opposed to the number of people. I don't want to use human beings as simple words, but it's kind of a quantity versus quality. We may have a lower quantity, but the quality of individuals is much more unique. Again, use of force. I can't speak to 2017. I don't know exactly what was going on there, but it may be an outlier. It may be part of some other system that was happening at the time. But obviously, the last 4 years kind of show the trend and where we're heading as far as use of force. And use of force, another thing I'll tell you is we've kind of changed over the years, and maybe this explains a little bit of 2017, in that we used to consider a lot of things a use of force that really weren't. If a person says, I'm not going to court, and we would maybe hold them by the arm and walk them to court, that would be a use of force. And we've kind of restructured how that works. So maybe our reporting is a little different, but I can tell you that in the last 2 to 3 years, we've been very consistent in our reporting, and the numbers, even if you just go to 19, show the steady incline. And I know that again, I know that tickets written within the jail can be, that number can fluctuate. It can also obviously be very dependent on the officers themselves. Some write tickets, some don't, and they can be for something as simple as not wearing their wristband. But it can be also be for things such as, threats again. I mean, it can be things like if you threaten an officer, we may not file a criminal charge, but you could get a level 3 ticket, so to speak. But again, I think if you the numbers themselves just kind of show that where we're at just from 20 to 2021, the uptake, and we haven't changed our processes on how we report or what tickets we write. It's the numbers. I don't feel like there are any outliers, especially for the last 2 years. So I feel pretty strong with those medicals. And I wish I could give you a good example of what this is, but it's obviously since 2019, 2020, we've had a huge uptake in heroin, and especially fentanyl or fentanyl laced heroin. And when a person who is stopped or arrested or brought to jail with that stuff will typically ingest it prior, so they don't get caught holding it. And once they're in jail is when the effects take hold. And that's something that we deal with on a very regular basis. And I'm not saying that we've had 59 cases of them. We've also had people who have had seizures, and true medical emergencies, but the drug-induced medical emergencies has certainly risen. For the close observation suicide watch, just to do the kind of nuts and bolts, a close observation is when somebody who is clearly displaying signs of needing some extra help as well as observance. So what we do is they will not be, their lifestyle will not be changed. They are in and out of their cells as their classification dictates. However, we move our 30-minute checks that we do down to 15 minutes. So that person is checked on every 15 minutes visually. And it can be pretty intensive, especially if you have like our medium pod as of today has 61 people. It only houses 56, but we have 61 people in there. And if you have 2 people in there who need to be checked every 15 minutes, that can be pretty resource intensive. And then you move into a suicide watch, which is somebody who is actively suicidal or who has a plan or has stated, I'm going to do this. We place them into a special cell. We have special clothing and protocols, but what it requires from us is 24/7 nonstop observation. So a person, we pull up a little table and a chair, and we have a staff member staring at them through the window of their cell 24/7. And we've had times over the last few months where we've had 2, if not a third person on. So that takes, you've got all the people that are operating the jail, and all of a sudden you need 3 people dedicated for this one particular thing that they can do nothing else. And so the suicide watch has become a very big deal, much like we've had inmates admitted to hospitals, area hospitals. Normally it's LMH, but we recently had somebody at KU Med for a couple of weeks. So we have to have a deputy who is armed and can be stationed in that room 24/7 with that person until they're dismissed or released from custody. So those are the kind of things that we can't really quantify, but when they do happen, holy cow, they can really wreck a shift over time. So, and I'll explain, while the work has increased, the main jump that I can tell you from the 2020 up to 2021 is simply the fact of, like I said, we have our housing unit, the largest housing unit, medium, it is set up with 56 cells. You take one of those cells out because we have to leave a bathroom open for the men. There, it is a male, men who are currently residing in other parts of the housing unit. So you have 55 cells, so that's 55 people. And then we have anywhere from 6 to 8 other people who are on cots, or what we call them boats, but they're just kind of a plastic cot with a mattress, either in a programs room, or recently we've actually had to move some out into the day area. So when you have when I was coming up and working in the jail, it was me in there with 56, upwards of 56 people. We realized that was just dumb. So years ago, we moved it to 2 people on day shift while the men are out. Now it requires a third person just in that housing unit alone to operate it safely, because we have so many different classifications. If you have a suicide watch, or if you have a close observation on top of just doing all of the normal work that 60 inmates require, a third person. So we've had to pick and choose blocks of time where we need that third person in there, and we create an overtime slot just for that. So this person will sign up as the third medium officer and come in and work. So we've had to do that with medium, women's, as well as what used to be our work release, which is now our de facto minimum. So that explains some of that. But again, that's why we're asking for more staffing, is to alleviate some jail overtime. But we will never get rid of overtime completely. I don't think any of us are trying to sell that used car. So that's it. All right. Did we win? So that's the jail. Did you have one for the operations as well? Okay, that's this one. Okay, now do we want to just talk about jail and then move on to other positions first, or attack them one at a time? Yeah, whatever's easiest for you all.
This is Commissioner Portillo. I just have a question about kind of your distribution of resources,
Mhm.
because I know that you need more folks in the jail. Is it possible to pull folks back from patrol into the jail? Is that not feasible? Just help me understand.
Yeah, so it's Rob and Peter to pay Paul first off. The one thing that I can tell you about the sheriff's office, and it's been true since I've been here, and it will be true until the end of time, is that our staffing will always be dictated by the number of corrections officers we have. We can do nothing else until we have a full jail staff. So because, well, that's one of our statutory requirements. So we have to run the jail. We don't have to have patrol. But as we'll talk about, our call loads on patrol have increased substantially as well. So we can at times, and we do, like on, say it's a Tuesday night shift, which is maybe not typically the kind of night that would be busy, and the jail has an open slot that they need filled, patrol will send somebody in to do that. But so the short answer is yes, you can pull, but again, you're robbing Peter to pay Paul at times. And obviously the stakes can be pretty high if you're short on patrol as well at the time. But yeah, and that's the beauty of our agency though too, is that we are cross-trained to where you should be able to work pretty much anywhere.
I noticed that both the medical incidents went up and kind of the number of folks who need additional supervision. How much do you think, how is Osawatomie playing into this increase, and is there anything we can do about it?
Yes. So when we talk about Osawatomie versus Larned, for us specifically, Osawatomie is viewed as acute care. So it's somebody who is in crisis right this second. They go for a couple days, come back. But then when we talk about Larned, we have the people who are charged and need to be found competent, or they need to regain competency through medications or whatever. So they both present the same problem, but they were still different animals. The acute situation, Osawatomie has actually been very good to us for the most part. And we're very fortunate they're only 45 minutes away from us, whereas half the state uses them. And some of those folks will take 2-3 hours for a round trip. They've worked with us very well. They do the best they can, obviously, but it does require us to hold on to people who are so resource intensive that, first off, we're not trained to house, hold, treat, care for these people. All we can do is keep them safe to our best of our ability, but that is very resource intensive. But then you scale that up when we start talking about Larned, because we will have people who have, well, a gentleman that just came back from Larned, he had been on the list for 13 months. So for 13 months, he was charged with a crime, but had never gone to court because he had to get there. And he was a very resource intensive inmate. And I don't know what the count is today as far as our wait list for Larned, but we were around 13 people just waiting to go, just waiting to go. And I know there's been some publicity about one specific case where that person was found to be incompetent to stand trial. So we are now waiting for that person to go and regain competency if they can, and then come back to us. But in that meantime, we are having to move a lot of resources towards those folks. And so I wish I had an answer, and I know there's some things moving with it's KDADS, or I think it's KDADS, and then the ACLU and all that stuff. But it doesn't really matter right now because we are stuck. We have to hold these people, and we are fortunate that we have the facility and the people and some trained staff that can do some of this work. But ultimately, at the end of the day, it's a stiff defense. We are simply doing our very best to keep them safe, and that's not what we should be doing, but it takes up a lot of our time and resources for sure.
This is Commissioner Reed. I had the same question as Commissioner Portillo, so I appreciate that. And also, and kind of figured exactly what you just described, that it's putting a pretty intense pressure. I don't think it's the same amount of pressure, but correct me if I'm wrong. I'm curious what the population or what amount of the population is in their post-sentence awaiting KDOC transport. Can you just talk to me about how that generally, and I know you may not have exact numbers, but generally about how many folks you feel like are staying?
I believe that we are getting, I believe that backlog is alleviating itself to some degree right now. We are getting folks who are being sentenced and they're getting out of our facility within a month or two, where it was 6 months to a year. But I can't really speak to the numbers themselves of conviction or just waiting to go to DOC. But I do know-
Timeline helps because I had about 6 months in my
Yeah.
mind and I wondered if that had
I believe we're
improved.
getting it back down to about a month. Yeah, the district court is moving quicker. The state is moving quicker. Now, we always have outliers of people who have, filed some crazy appeal or something, or they're simply they're going on a very low level charge where KDOC is going to drag their heels, just because they would rather not hold this person for as long as they can. But again, those are unique. I would say for the most part, things are moving back towards where they were pre-pandemic as far as the backlog. So we always know we're going to have somebody, you're convicted on this date, sentenced on this date. We're going to have that person for 4 to 6 weeks probably.
That helps. And just from a revenue perspective, I mean, it's my understanding with the KDOC transports after conviction and when you're holding them while they drag their feet, there's some sort of reimbursement and revenue for that, right? Talk to me about that with Learned. Like when people is there anything at the state level that helps compensate for that time?
Absolutely not.
It's just purely on the county.
Yes, yeah,
Okay.
and again, I could talk all day about the Learned situation, but we in this county are uniquely designed to handle it as well as somebody could. But if you go to any county left or right of us, it is devastating to their jail population and their staffing because they just can't handle. That one person can upset an ecosystem that we are fortunate enough to have the ability, but we need more people to run that ecosystem that we do have in place. So I don't want to make it sound like we're good at what we do, but we've unfortunately had to learn how to do this, and we've come up with something that is about as good of a bad situation as you could get.
I'm not trying to create more work for you, but Mr. Reed's question did make me think, like, is there any way for us to see data on like how many nights we're paying for as we wait for folks to go to Learned? Because that, just from an expense perspective, would be interesting information.
From the Learned or the KDOC would be a little tougher. Probably we could do it for sure. Absolutely. I know we do keep a running list of persons who are awaiting either competency evaluation or competency restoration at Learned. And at any day, at any time, you can call in, or we can call the nice Bert Dash ladies and say, who's next on the list? Who's been on the list the longest? How many do we have? Because every week or so they get an update and says, inmate so-and-so is now number 17 on the list. Inmate so-and-so is now number 45 on the list. And so we can kind of track it. So yes, we can totally give you those. We can get those numbers, and especially now that we know what the daily cost is, it's expensive. Expensive. Let's do it. So yes, I don't have a fancy. So this was, I had some very good, helpful people create, and it's like 6 hours long. So I did us all a favor and we just kind of condensed it. So our county has not changed, so to speak, over the last 7,000 years, I think roughly, maybe. We have like a few more cars now, but so what we do have is we have 475 square miles where we still have the city of Lecompton that we were responsible for, as well as all the unincorporated. And as many of you well know, that we are becoming a very urban rural community. And so we have a lot of 5, 10, 15 acre plots with a house on it. And so I don't really even consider us a rural county much anymore. But with the number of rooftops having increased over the years, obviously the call load and the needs have increased as well. But COVID skews numbers, makes things tough. But what I can tell you is, even from my own experience, is that the seriousness and severity of the crimes, like it used to be kind of an oddball call, like a once every 2 or 3 years where we would have a gun call, a call involving a weapon, or we would have a homicide. You know, in my 24 years, we've had 4 homicides, I think. But in the last 2 years, things have just changed to where it's more commonplace to run across folks who are armed, to have confrontations involving an armed person. We just had a brawl last night at the Lone Star Lake involving multiple people where multiple weapons were brandished, and we have a deputy there. You know, it's not the old Texas Rangers anymore where you only send one ranger. Well, you only got one riot. We are outgunned and outnumbered. In a situation like that last night actually really scared me. And just so we all know too, there was 2 calls going on simultaneously. Our call and the city had a call, and there was a total of 16 officers on all of them, leaving basically nothing for the rest of the county. But those are the calls you have to respond to. So when we look at the actual numbers themselves, over the last 3 years, we are seeing a steady increase in the batteries, the assaults, our car stops in traffic, but sex crime, psychiatric calls for service, property crime is up as well. But really our total calls, we're in 2020 it was 26,400, 2021, 27,000, slight increase. This year, we're a little over halfway. We're at 14,000. So we're going to probably end up right around 27, 28,000. So on pace. But we're doing that with the same number of deputies we had when Stacy and I came out in 1999, 2000. It used to be that we would work with 4 and a 5th on the weekend. And now we work with 5 and a 6th on the weekend. But our patrol division has been cut to the point where we have to keep as many people in the jail working as we can, and we can't fully staff our patrol at times. So they're the ones that have taken the back seat for the last several years because our jail population has become so unique and troublesome. But we have the beauty of it, though, is we have very good corrections officers in our jail who want to be deputies. And so hiring for that position is not tough. It's hiring for the jailers, which, by the way, we are the only agency that I've seen in the state of Kansas who is fully staffed. And I say fully staffed with a tongue in cheek in that we're still putting up 1,800 hours of overtime, so with full staff. But that's just because of the nature of the job that we're doing. You look at the state of Kansas, they're 65 troopers short. The city of Lawrence is right around 30 officers short. Johnson County, who pays way too much, they're losing people, and they're requiring each of their deputies required to work one of their days off every week because they are so short staffed. So I know that the question has been recently is like, well, why do we even need new positions if we can't fill them? I can fill them. I just need more bodies now. And the jailers is where it's at. So sorry, I kind of got off topic here, but the numbers, the patrol numbers are clearly increasing, but our patrol staffing has held steady. On top of that, we have several other things that we have a warrants unit, we have a directed patrol unit, we have a drug nexus unit, and those are running at bare bones as well. So, and when it comes to our drug unit, I want to be very clear when I talk about the Douglas County Sheriff's Office and my take on what a drug unit should be doing. And that is, we have a fentanyl and heroin situation that is killing human beings in this county. And therefore that is what we're after. I don't care about Delta 9, Delta 8, marijuana or anything. I want to get the stuff that is killing people off the streets. So but we can't do that work. We only have one person in our drug unit right now. And you can't do anything as one person except just kind of play a stiff defense. But I'm also an open book if people want to ask questions about that. One last thing I will talk about is animal calls. So as I talked about, we have a lot of mailboxes on the roads that we didn't have 10 years ago. And every one of them brings with them at least an animal or two. And people get very unique when you try to explain how animals now need to be kept leashed and protected and everything in the county. And so even then, so in 2020, we were at 475, last year, 567. These are just animal calls. This could be loose cows. This could be a dog bite. But this year we're already over 300. So we're going to be in the 600 range probably. And I can tell you this, each one of those is a tough call, except the loose cows, because normally they just go right back in. But if it's dealing with a human being and their dog or their cat, they can be very time consuming. And we respect that. But we're also trying to change how the Humane Society helps us. And that's been a very, very beneficial partnership that we've built. But these kind of calls have to be talked about because they take a lot of time. So last thing I'll talk about is accidents and traffic stops. Our traffic stops are actually way down from what they were 10, 15 years ago. We, as an agency, may stop a lot of cars, but we don't write a lot of tickets. And we have our own thoughts on that. But what has increased is the number of accidents that we work. There's so as we talked about the Kansas Highway Patrol being 60 some odd troopers short, we have had to take up that slack. So we have one of the busiest state highways in the state in the South Lawrence Trafficway. It is per capita the busiest highway in the state. It's unbelievably dangerous. And if KDOT, if somebody gets killed, I'll sign up to help them talk to the state about why that road needs to be changed. But we are the only ones that can't shut our lights off. The city of Lawrence can pull all their police. The city of Baldwin Eudora can pull all their police. KHP can go to other counties. We cannot shut the lights off. And accidents is where it has really reared its head that we have turned into. So anytime you go to any county next to us, and if they have a big nasty wreck where somebody loses their life, they will wait on the troopers to show up to handle that call. We have built an accident investigation unit that rivals any troop team because we've had to. We simply can't have our citizens or people sitting and waiting for somebody to come and help them when we're standing right there. So we have learned how to do it. We've become proficient and very good at it. But that's also very time consuming, where you look at the wreck 2 years ago where 6 people lost their life on the South Lawrence Trafficway. We worked that. Any other county would have waited for a team of troopers to show up out of Topeka, Kansas City, Wichita, wherever. But that's what the scene demanded, and that's what our people demand. So therefore, that's what we do. And I have no problem doing that. But that also took 4 deputies and a detective off the streets for 5 days. So it's a balancing act. But we believe that we have to be, in order to be the last line of defense, we have to be able to do anything, and we have to have the people to do it.
Thank you. This is Commissioner Reed. I have a couple questions. Well, maybe this is an easier one. With the animal calls, will you tell me those numbers one more time?
Yeah, so 2020 was 474. 2021 was 567. And then this year, we're basically 300. Right?
I mean, it's an increase. It's not, it's an increase. Will you just, I guess, help us understand how that partnership with the Humane Society and the new code and policy that we passed last year, how that has been impacting it?
Yeah.
Is it making a difference on officer time and resources?
So without having worked a dog call for the last 6 years, What I do know is that it is beneficial to us because they have taken over. It used to be the fact that we would go out and we were the dog catcher, we were the investigator, we were the transport. We did it all. And on top of having to deal with a human being and their beloved dog. But now the Humane Society has helped us out for a transport, but also for the investigation portion to be an assistant with if there is some sort of criminal investigation, but also if there's just like a check welfare on an animal. There's a horse that always gets called in because he's 150 years old, but he looks like they're not feeding him. Well, he's old and in hospice basically. But we can just let them know, hey, there's this horse, can you go check on it? And they'll go out and look at it and they'll call us back, say, oh, it's, everything's fine. Or this is a problem. Can you guys come out and help us? So that has been very beneficial for us. And I can tell you this, that like juvenile calls and dog calls are two of the least favorite calls for a patrol deputy because they're intensive and nobody wins. So we're very glad to have the Humane Society on board for those.
Good, I'm glad to hear that. So about the accidents, I really appreciate the praxis and the practice that we don't just wait for other people to arrive. And at the same time, we have filled a gap created by the state, which is sort of a theme at the moment. And so I'm just trying to work that out in my head. And I mean, to see that 6 to 7, I hear you say that they're down staff wise across the state. And so that obviously has ripple effect, and our ability to fill in that gap makes it not necessary for them to really work here. However, that feels like letting them off the hook and absolving them of a responsibility that they have to the highways that run through our counties. So for them to have been 6 to 7 highway patrol officers down to 1 who maybe isn't really available. And so that's 1 on paper, perhaps, but not necessarily in practice. I'm struggling with that a little bit. And I guess there's not really a question in there, except I guess, will you just help me know what the county's conversations with state highway patrol have been about that, and whether there's other solutions or possibilities there than us just making up for that
Right.
difference.
Well, I wish there was an easy answer to say that help's coming or help is on the way, but I can only give you anecdotal information of what I've learned over the last year or two from troop itself and troopers who work in that. They are so short, and the counties out west, they need their trooper way more than we do. And the troop, some of the higher ups have even said, why would we even put a trooper in your county? You guys can do everything. And again, blaming the victim, we moved into that role out of necessity, and now it's being used against us. So it is very disheartening. But again, we don't want to back away from it because our citizens are the ones that will pay. So I don't really know. I have my opinion as to what needs to happen on the state level. But unfortunately, that is just that. And I don't even know if that would work. So it's a long non-answer, but ultimately it falls. And I'll tell you this, you succinctly nailed about everything that the sheriff's office does, is that we fill in gaps where others lay down. You look at just simply going out to our court or our jail and how court information is input into the system. We have just done that over the years because it was easier, cleaner, simpler, and more accurate and timely. But now it's become a necessity that we continue to do it and do it at that level when it was never really our job to begin with. And I'm not blaming anybody but we did it because it needed to be done. And now all of a sudden it's required that it be done in the way that we've been doing it for years when it was never our job to begin with. Same with the troop or the highways. We've filled in we believe that the people deserve the best service, and therefore it had to come through us. But we can't back off and say it's your turn because they don't have to. They're not required to be here. I am.
Commissioner Kelly, can I ask just one more question? So I also heard you talk about Lawrence Police Department being down about 30 folks. And I think part of your narrative was about sort of basically co-responding in more City of Lawrence calls. Is that purely because of their lack of officers? Has that been historical practice? And then my additional question to that is, obviously the volume is not comparable at all, but in terms of Baldwin and Eudora, as the other cities that have their own police departments, talk to me about how often or if ever you are
Yeah.
co-responding in their city limits.
So I'll do the Lawrence piece first. 30 may be off. That number is old. I don't know. They may only be 10 or 15 down. But what we have found is that so they upstaff for a big part of the day because that's when a lot of their call load is. That's when the animal calls and the theft calls and all that stuff. But then when the evening time rolls around, they tend to roll more people out of the streets and have smaller shifts. But that tends to be where some of the more critical incidents can occur when the sun goes down. So we've always had that relationship where if they need help, we come into town. It just seems to be that we spend more time nowadays in there. But the other thing is too, is that if they get a big call, I think back to the night I was working when the homicides happened right here at 11th and Mass, the shootings. And I personally was the shift lieutenant, but I was shagging noise calls because the city had other things they needed to be doing. So there are things that we just step in and do. It just seems like the frequency of us having to do that has increased, and the severity of the crimes that we need to assist with has increased. Again, tough to put numbers on, but then on the Eudora Baldwin situation is that answer is every day, all day. Those places typically have one, if not two officers working at a time, and so even something as simple as a burglary alarm at a building, at a business, that requires a 2-officer response. So they're automatically going to send the Eudora officer and one of our deputies. If there's a domestic disturbance, it's going to be the Baldwin officer and one of our deputies. So that's always been the agreement, is that we are their back units, but we also do the same for them. We'll be in Lecompton and have a call down in Baldwin, and we'll ask the Baldwin unit to leave town and go and help us. I mean, so that's a very typical relationship, but it's very symbiotic in that we are theirs and they are ours most of the time. So we work very closely with the smaller agencies.
That symbiotic relationship makes it sounds like it exists with the 2 smaller communities, because based on numbers, but is it fair to say that symbiotic relationship is not necessarily the same with Lawrence Police Department? They're not responding to sheriff's calls when there is an issue that sort of necessitates that, or is absorbing a lot of your resources.
Only at request. If we have a big call or something that's right there on the bypass, they will do it. But if we have a call down in Baldwin and we're somewhere else.
Sure. And sorry, I don't mean to belabor it too much, but I appreciate the spirit of, and just the tradition and also necessity of that sort of mutual aid agreements and symbiosis in certain instances. But have those always been informal agreements? And is there any sort of, I'm thinking about Lawrence Police in particular and the volume of, just anecdotally, I feel like I see deputy units responding to in-city calls more frequently in the past couple of years. I just don't know if that's because I'm paying more attention or what, but it seems noticeable. And so I'm just thinking about resource wise, like how much is that really absorbing? And if there's no sort of pay for service or fee for service or formal agreement around that, those are the things I'm questioning. I guess I just kind of wanted to point it out. It's more of a comment than a question.
Absolutely. And I'll let you all ponder that. Ultimately, to me, though, I look at it through an entirely different lens, in that somebody needs help, we're going to send somebody, pure and simple. But on the back end, I'd be more than happy to help you try to slog through that and figure out how to best do it.
This is Commissioner Kelly, and Commissioner Reed hit on some of the questions that I was going to ask about co-response and what I guess my question is what data we're keeping on those co-responses. And then once you have that data, are you visiting with those police chiefs in those communities? Because I do think if we're seeing a significant cost and you're asking for more patrol here based on that significant cost, then it's on us to sort of say, hey, if there's that cost there, we're going to need to have a conversation about that fee for service. And so I don't know that there's a question. Well, yeah, let's stop there. And just what data that you keep on that?
Well, of course, we have, we have robust data, but again, anytime you deal with a call, we just spent the last hour talking about this, how our data can be so different based on the totality of the call itself and who inputs the information. I can tell you how many times we've been dispatched as a back unit to, say, the city of Eudora. I can tell you how many times it was for a domestic versus a burglary call or alarm call. But what I can't tell you sometimes is the outcomes of those, or how many of our people maybe went, or how, or perhaps the city unit and the county unit responded, and that city unit arrested a person, which takes them off the streets. So we now become the Eudora Police Department. And how many calls did we answer after that? I mean, we could dig those out, but that would be very difficult for us to really kind of parse out. However, we could certainly come up with numbers because we track what is self-initiated versus dispatched versus requests. So I think that we could come up with at least a rough idea of how many and how often. The brains of the outfit.
This is Commissioner Portillo. It sounds like maybe the question isn't all, I think those details that you're talking about are incredibly important. But the question may just be the trends over time. So are we seeing increases in the number of times you're called as backup in Eudora, in Baldwin, in Lawrence? Not necessarily all of the downstream effects of that.
And I think you're absolutely right.
And what is this threshold that you would consider? I mean, it seems like you've hit a threshold here by asking for more patrol. What threshold do we hit when we say, okay, now we need to have a different conversation with our municipalities about what kind of supports we're providing? We had a recent conversation, and this sort of flows into my next question about jail rates and, having to cover that cost. I was sort of surprised to see our increase in jail rates followed by a request for more staffing. Can you talk about how that increase in the daily rate for jail has impacted your staffing? I mean, have you hired more staff based on that, or we don't have enough yet, or?
Well, I may not be able to put those two numbers together succinctly as I want to, but I think the jail daily rate that we've figured shows the amount of work that we've been doing with the staff that we have. And, I don't want to quantify our staff simply off of a number that they're only worth this much. But the day before we did the recalculation, they were doing the same amount of work for half the price. And I think that just really showing that number confirmed what we've always known, in that we do a lot more. And it obviously needs to be, the amount of work we do needs to be paid for at a reasonable rate. But I think it also just kind of goes to show that there is so much more to our jail, especially, that requires so much more intensive resource laden work that our staff does, that we've just, again, done for years. But now we've reached kind of a nexus or a zenith, whatever. I don't know. I'm not quite up to the Z in the dictionary yet, so I don't know if I'm using that right. But we have kind of hit a space where the needs of our inmate population have outgrown our abilities as this number of staff. And it's borne out through the numbers of officer needs assistance, but really it's borne out through the number of SMIs, seriously mental ill people, that are in custody, and they're in there for so long, and that we just simply, we can't keep up with that kind of treatment for this number of people. And obviously the city has one individual who has been out of custody in the last 4 years for like a total of 16 hours, and that person is extremely labor intensive, resource intensive for us. And so, but when it was just that inmate and maybe another one, it was okay. Now we've got 15 that are that same way. So I don't know if that quite answered the question, but
Sheriff, this is Commissioner Portillo. I just want to be really careful with how we're responding to that question, because I think part of it is it's not that the staff was paid less one day and
Right.
paid more the next day. It's that the county's portion of that pay was adjusted because we started charging cities the actual amount
Right.
that it was that day.
Yeah.
And what it sounds like is that needs have increased even since we just did that new adjustment.
No, I think maybe we're saying the same thing. I think I just probably misstated is that I think from a bill of sale, they were getting the same size. They've been getting the same size bag of potatoes. We've only been charging them half price for it. And so I think that kind of helps us to show.
Yeah, and I just want to clarify that that new jail rate is in 2023.
Mhm.
So we haven't actually
Yep.
received any of those new funds at this point in time. So we're still getting paid for half the bag.
Half the-
And then I would also add that, like, if you look at the revenues on the sheriff's page associated with that, I think this is something that we as a staff want to kind of see how it all comes together. As the sheriff's office staff know, in many cases, a person who's brought in on municipal charges could also be charged with a district offense. If they are charged with one district offense, the county pays the bill. So I think there is some concern on our part that the amount of municipal only prisoners will drop dramatically because of the increased cost per day. So in our conservative revenue estimating approach, we did not plan for a significant increase in
Mhm.
revenue yet until we're able to really get a better sense of what does this new rate do to actual charging
Right.
and the folks we see. Want to talk about the code for the training?
Yeah,
officer?
sure. The,
You-
the,
yeah.
can we talk about the cook? So, just like everything else, with the change in the dynamic of our inmate population, we no longer have a robust pool of eligible or able workers to, and I say workers, and I don't want this to sound as if we are simply trying to save money on the backs of incarcerated persons. They are approved through the court, they're approved through our classifications, but also they are compensated through their hours worked towards time off of their sentence, as well as hours worked for X number of dollars per hour off of their fines and fees. So, and we don't force anybody to do it, obviously. But we field two kitchen crews, AM and a PM, and it's supposed to be 5 of each. And then we have a 2-person laundry crew that works the overnight hours, and they do all of the laundry for all of the housing units. Typically, it has been males who work in the kitchen and female, just simply for the percentages. And obviously, we can't have them working together, but that has been how it's worked out. However, we are just struggling at every turn to field enough people to work to keep our jail kitchen going. We have hired jail cook staff, but it is the lowest paid, and they are working day in, day out, side by side, shoulder to shoulder with inmates. And that's a very tough thing for some folks to reconcile when they want to apply to come and work for us, because there is a certain amount of stigma or belief as to what that will be. We have been fortunate to have some very fine staff who have been with us for a long time. And so we need one more, because we can't fill in the gaps with inmate workers. We're just simply going to have to hire more civilian workers to continue to work in there, and then try to get as many inmate worker hours as we can from the right folks. I will say that the starting pay for cook is not enough, and I firmly believe that they really do the same work for the most part as a corrections officer, and because they work day in, day out with. So I would like to, and I'll kind of work through that on my own, but I hope to up the starting pay just a little bit to make sure that they know that they're valued. I don't want the lowest paid people in the building to be doing the same amount of work or the same work as others, but that's something that we can kind of handle. But I need to get the positions first, and cook is very important to us right now. And these are very difficult positions to fill. I'll tell you that. Even if you were to give me this position, it can be very challenging to find the right people, but we have been fortunate enough to find the right people most of the time.
I don't have any questions about that. Do you want to talk about your last?
Yes.
Request?
Yeah, so the last is simply it's kind of a catch-all. We didn't really know how to best label this, but with the onboarding of our body worn cameras, with the way that our training division has gone almost completely digital, the scanning of files, we basically, IT has become the key to the world anymore. But what we need now is somebody who simply can just do the administrative work to make sure that when we go in and look for these files and information, and it's not just training, it's not just, this, that, or the other, it's all. And, we have our registered offenders, sometimes they're super busy or they have a lot of files and administrative work that needs to be done. We want this person to be kind of a jack of all trades, but really where we envision this is in this, and we already have a person doing this who would like to be full-time. So really it's a half position that we're asking for. But if you were to look into, say, my training file, I've been here for 24 years, and it is a hodgepodge of like it may have 2 or 3 things from 3 years ago, and then the next page after that is going to be my 1999 KLETC transcripts, and then it'll go into something else 7 years ago, and then it'll go, because we've just kind of updated and scanned and moved things in one at a time as we got them, and now it's kind of created. Now it's all digital, but it's a digital mess, and so we want to develop a system and then also maintain it, but also get back in and clean up what we already have. And we feel like this position is something that will, not only do we need it, it could possibly even grow into the future. So it would be civilian. Like I said, we actually have a gentleman who works for us who is outstanding, and I would love to bring him on full time, but that kind of is the crux of that request, if that was a long-winded answer to say nothing.
So Sheriff, this is Commissioner Kelly. So is the request that we have here for the rest of a part-time position or a full-time position?
It's for a full-time.
I have it as a full-time.
Yes,
request.
we have a person hired who is working part-time, no benefits, and we would want to bring him over to a full-time position.
So, but would that be 1.5 FTE or 1.0?
No, we would not.
FTE?
No, he would just move over. It would just be.
Okay, from 0.4 to.
Yeah, we would not
Okay.
backfill his spot. Yeah.
Okay. So then we'll need to go back and adjust that.
Oh, I'm sorry.
Because it's in here as a 1.0 FTE. plus
Oh,
benefits, not
okay.
a 0.6 plus benefits. Yeah, it happens.
I hope
So
that's the
we'll-
worst thing I do today.
Yeah. We'll get that number fixed and get a revised number to commissioners so that you have that.
Any questions from the commissioners? Sarah, did you have a thought?
No.
Your mic's just still unmuted.
Yeah, no,
Okay, well, thank you all. I appreciate your time. Thanks for being here. Have a good rest of
for
your day.
coming. You'll have to wait and see. Right, right. Right, day one. Thanks. Commissioners, we have Public Works here to just talk through their budgets. If you, Chad, if you want to come up, we don't have any supplemental requests from Public Works. But I thought it would be an opportunity to, it's a large part of our budget, so I just wanted to have an opportunity for commissioners to, if they had any questions of Public Works. We did include in the proposed budget a number of cost increases, just routine cost increases related to fuel and fuel-based products built into both the road and bridge budget. And then just remember, commissioners, that there is the fleet budget and the parks budget is in the general fund. So there's kind of two parts of their budget depending on what you're looking at. So a lot of the fleet increase costs were in the general fund, not in necessarily in road and bridge. You know, Chad, I know when we met and talked about your budget and just opportunities, it's just a really challenging time at this point to even secure respondents to bids at this point. So we tried to take a pretty measured approach to what we included, knowing that this time next year or April of next year, when we're dealing with the re-estimated 2023 budget, we will see if fuel prices continue to stay so high and if the labor market or the contractors responding to bids, if that market is as tight as it currently is. I don't know, Chad, if you have anything you want to offer there in terms of what we put together.
Sure. Good morning. I made some quick notes on fleet just in terms of numbers. So diesel and gasoline are the big story in our fleet budget because we provide fuel for all the other departments too. And under that line, in 2021, we were at 410,000 actual for diesel and gasoline. In our re-estimated for this year, we're at 725. So massive increase. And then our crystal ball for next year, we tailed that off a little bit to 675, just to put a number out there. Hopefully we can see a better story than that. In the parks budget, we are looking at 50,000 increase in equipment reserve. It's getting hard to buy things and they're getting more expensive. So Doug does a really good job of keeping a list of equipment for the whole department and projecting what needs to be replaced when. We have, I don't know, 50 plus pieces of equipment on that list, and some of them are big ticket items. So in parks, tractors get fairly expensive. So we saw that we needed to bump that a little bit. That's really probably in terms of the entire budget discussion for our department. That's the only thing we're actually looking at an increase on right there. And then in the road and bridge budget, which obviously is the big one, fuel prices basically tied to asphalt delivery materials. So road salt for the winter, asphalt mix, all of those things we've bumped up looking forward based on the price indexes that we're seeing right now, and try to project that into next year somewhat. Do you have anything I'm missing or you want to add, Doug? Okay. Yeah, so no supplemental requests, no changes to our baseline items. And we're really just waiting to see what happens with pricing. You mentioned bids that we've had recently. And so one of the things that we found is that contractors are short on labor also, and they're having a hard time, looking at a project and not thinking they might be paying overtime, or having a hard time finding people to fill it and meet the schedule. And so our tack is we're going to open bids again on one of those projects in a few weeks. And the idea was to set a wider range for the start date to give them a lot of flexibility and also expand the working days. And now we're looking at probably getting into next year with some of that work. So overall, all of our projects, we're probably going to have a pile up next year of bids, but we're really just trying to get some work out there and get it at a reasonable price right now. So you'll see that at some point in the next few weeks, hopefully on a bridge project that we want to rebid.
And as we stated this morning with commissioners, we'll be back this fall, sometime after budget. We haven't set a firm schedule yet for CIP. So, but we will be back to talk about the status of the CIP and what projects are specifically slated to proceed. I know commissioners have had some questions about that from the public related to the Wakarusa extension project. And so I think that will be part of our conversations later this year in terms of that project. Unless commissioners have more specific questions.
This Commissioner Reed, I don't have any questions, but appreciate you, Chad, for well, the whole department really for, I think you all do a really good job of projecting out those costs. So like just describing that list that you've got of the equipment and trying to predict when we're gonna need to replace it. I just want to acknowledge that I think you all are doing a really good job at trying to project those costs, make conservative estimates where necessary, pause on some of these projects because of the situation that we're in. And so we just wanted to compliment that and appreciate y'all being here this morning. Any questions from the commissioners?
I just have a couple of questions. I noticed it's not the packet, but in some of the materials that you provided us, an increased cost for rural fire district 1 as it relates to fleet services. Has there been any conversation with the rural fire districts? I mean, we essentially pull money from those townships for that and we organize all that. Have we had any conversation with townships that cost may need to be passed on to them?
We have with Consolidated Fire District 1, and they have increased their budget portion related to vehicle repairs. And also one of the vehicles that's really been a frequent flyer in the shop is slated to be replaced with those ARPA funds that the commissioners have allocated. So I think our hope is to really improve the quality of their fleet and to reimburse Public Works as appropriate.
Okay. But it won't impact our budget request is what you're saying. We have talked to them, but it hasn't impact. I mean, we still have an increase.
Well,
in
so
fleet
the
service
revenue, it
costs.
should be revenue neutral in some ways,
Okay.
because if we will reflect the expense, but we would also reflect the revenue from Consolidated Fire District 1.
Right.
And I just want to be clear, the only district that we support in terms of fleet is CFD 1.
Right.
Is it. So they have added costs. I think we will have to match up, make sure that, you know, I'm generally a little more conservative on the revenue side than I am on the expense side, but I know that CFD 1 has added more funds to help support their fleet maintenance needs.
Okay. My second question around fuel costs. And, you know, last year we didn't predict the fuel costs that we're having this year. So are we using fund balance to cover that difference right now? Are we using other funding? I'm just trying to, fuel is such a hard thing to predict cost wise. And so, you know, increasing funds for that makes me a little nervous because we may not need it in the end. But I don't have a better crystal ball than anybody else. Well, I'm sure there's some economists who have better crystal balls than I do, but I'm just trying to think how we responded to it in this budget year. Is that, do we want to think about responding to it the same way next year, or do we actually want to budget those funds?
Yeah, that's actually how we did approach it. So because we re-estimate every line in the current year, it isn't just fund balance, because other lines in the general fund might have not cost as much. Frequently, they don't cost as much. With vacant positions that are currently unfilled, we can say right now, well, it's been unfilled for this long. Let's lower that cost, and then it can be shifted inside the budget. So we do that every year on every line inside the current budget. So we generally get pretty aggressive in the current year for that reestimate if we know what's happening with fuel. And 6 months out, it's pretty easy for us to figure out, like, all right, we're paying this right now. It's likely that we're going to pay it for next year. Oftentimes, and I think we even did this on the fleet budget, we then went back down slightly for 2023, hoping it would moderate. However, we can be in this exact same position next year, but we could also then say, hey, we re-estimated again, you know, we weren't so lucky. Those costs are going to stay high, and take advantage of those cost savings inside the current year to finance that. Obviously, I don't like to do that long term. If we see a trend, I think we had this conversation about salt. I'm just like, I think we should just accept the fact that we're going to use this much salt and plan to build in a larger amount in the budget. So it's kind of a mix of those two options that we go through when we review the road and bridge budget. Anything else there? crystal ball wise or anything like that. We do have fuel contracts and, we try to lock in some pricing, but it is difficult at this stage to really. Oh, yeah, wow. Yeah. Yeah. I remember the days we used to lock it in for 2 years at a time. Yeah, not anymore. Yeah. Any other questions for Public Works Commissioners?
I just had a question around that CIP rate of 7%. Can you talk about how you got to 7%?
I'm not going to pretend to say that it involved a lot of scientific analysis and study. So it felt like a middle of the ground, a road between the 12, but obviously we could have gone 6, we could have gone 5. I do, on your commissioners, on your commission decisions worksheet, you could dial that back depending on where you see the mill levy or other issues with it. So we just had to put a placeholder number in, and 7% is where Tammy and I landed.
Okay. Thank you.
And I would say I do like pegging it to the growth rate of the overall budget. It used to be based off mills, and that got really crazy. So this has been a way to help manage those costs a little bit differently. We do feel pretty confident that the balances are pretty comfortable in CIP. We feel comfortable that obviously something in that range of where the commissioners see the growth and assessed valuation is a good spot to land, unless Chad's got something different to offer there. Let us know, Commissioner, if you want us to, as we go into deliberations, if you want us to show that at like a 6% growth or a 5% growth, or an 8 or a 9, we could certainly do that for your consideration as you're working on your commission decisions.
This is Commissioner Portillo. I don't need to see it at a different rate, but I do just really like the flattening of that so that when we have years like this where we're way up versus last year where it was 2%, 7% is an average of those two. So not quite, but kind of flattening it a bit is helpful over a few years.
Yeah, and that was one reason, Cammie, I appreciate at the beginning talking about over time, what we've seen that percentage increase. And so as you're thinking about what we might ask for, I may be looking more around that average percentage that we see going up,
5 or 6.
so that we're not looking at 1 year in isolation. We're looking, because that should be your CIP plan is long-term. So that's just where my mind's going.
If we take that, then last year's growth rate of 2.75% did somewhat hurt CIP in terms of that growth rate as well. So that's certainly something we can look at. I do want to remind folks, what's unique about our capital improvement plan, as I try to turn to Austin, is that ours is cash based. We pay as we go for road improvements and for facilities improvements. We issue debt we do not issue debt for road and bridge projects at all. But we do issue debt for facilities related projects as determined by the commission. So it is important that this receive regular ongoing funding and that we dedicate a portion of our mill towards that. So that's it. Thank you guys for coming out. I know Adam is not here yet, and largely his request was handled through ARPA, but he may show up, trying to keep an eye on the time and keeping commissioners' times moving forward pretty quickly. We could talk about administration if you want to, while we wait for Adam, if Adam's going to come up. They're on my table. Your contracts are on my table. Yep. You want to go show them through? Yep. They signed them. I don't know. You might make it 4 just in case. Sorry. Got the contract signed. Under administration, I just want to point out a couple of different requests that are included in the budget and just see if commissioners have any questions on them. Included in the proposed budget is market and merit and longevity increases for employees. As I outlined to commissioners, we are planning on a 3.4% market adjustment based off of our job family compensation model. And then up to a 4% or a pool of 4% for employees for merit-based pay. That has been, we've been around 1% because frankly, that's all our budgets could handle in recent years. But given the concerns we're seeing about staffing and cost increases, we felt like it was important to try to have an increased merit pool in there. If there are no questions on market merit, I just want to point out too, included in the commissioner's packet in the notebook is a couple of requests submitted under administration related to ongoing sustainability of the housing stabilization collaborative funds. Commissioners have had conversations about that recently related to our ARPA process and also just, ongoing conversations with that group. This dollar amount of $300,000 is not included in my proposed budget and really is a starting off point. If commissioners included in the base budget right now is 120, correct? So this would be on 300, could be up to 300 on top of that. Certainly, if commissioners don't feel that that full 300 is something that they can manage in 1 year, we can, I think we can certainly talk about a lower amount there, but we are eager to try to build it. Yeah, if you want to come up, Jill, come on up. I think we're eager to try to build sustained funding. And commissioners, we talked about this and we talked about the amount of CARA requests that Douglas County has had funded over the last couple of years for rent and utility assistance. I think we are really worried about what happens if that spigot is shut off quickly, and how do we ease into a more sustainable model?
Yeah, and I was just going to say, as the Housing Stabilization Collaborative transitions to being a county program, and it's still making that transition, I think, and we use the county funds ongoing. I think that there's an opportunity to, if we know that we have a limited amount of funds on an ongoing basis, whether it's the current 120 or the additional funds that are being included that are as part of the proposed budget have been requested. I think there's an opportunity for us to have a conversation within the HSC to make recommendations to the county on what the income guidelines are for those funds. So we can be as targeted as possible, because as we talked about the last conversation that I was a part of, that we can't, the need is so great that we have to be very precise in what the county's funds are going towards. And I think that's a great opportunity to have the HSC to have some conversations and make a recommendation to the county commission and have ongoing discussions around who are our priority populations of folks we want to serve and how do we want to craft that program.
Any questions for Jill or I on that one? Okay, great. Looks like treasurers, thanks, Jill. Looks like the treasurer's here. And I just mentioned Adam. I don't know if commissioners, if you have any questions for Adam related to his expansion, you can come on up, Adam, if you want. What I would say is that from what we are talking about is the relocation of the 31st Street office. So not the operations that are currently here in the courthouse. So this isn't like elections where we moved all election operations to 23rd and Louisiana. This would be relocating the 31st Street office. The lease is up mid-2023. So we would want to plan for that transition to happen so that there's minimal downtime. I believe it is middle of the year. I think when the lease, which is always, time when you guys got nothing going on down there in the treasurer's office. So it'd be really important to try to do as much as possible to have as minimal downtime as possible. 31st Street office really just doesn't have any room for expansion. And so as we try to, if we want to have room to grow or to move staff that are currently working in the courthouse down to this new office, right now we don't have any place to do that. So we'd like to find a place that allows for that. Adam, I don't know if you have any thoughts about other questions or comments, or commissioners, you have questions? I figured once we got closer to an actual site selection, and so forth, Adam and his team could come back and we could talk through some of that. From our best estimation from conversations with our Director of Capital Projects, we're kind of looking at definitely end of the year. We're gonna start getting pretty serious about looking for leasing commercial property associated with this.
This is Commissioner Reed. You answered my questions about just kind of general timeline that we're looking at with the lease end date for 31st Street. Will you just talk to us about, do you feel like this is going to increase your need for more staff in order to staff that, or is it a movement, a spreading out of staff and a better geographical strategy for the county?
I think more of a better geographical position for the county. You know, right now the 31st Street's a little south. Ideally, I would like two offices that are in positions where populations on those side of towns can easily drive to a location. Not one population has to drive too far. We are maxed out where we are. We don't have any room for staff. So even if we wanted to add staff, we couldn't put them anywhere. So I think that's part of this reason too, is finding an office where we can grow if we need to. You know, if we need to add more staff, or if something happens downtown, we can put staff at the other office and still be able to operate. You know, we have a lot of projects, I think, coming up in this building that could potentially affect the closure of an office for a while, you know, while those projects go on. So having an additional space to kind of take on the extra load if something was to happen here, I think is a good idea. So just having a space that allows us to grow, allows us to have proper storage and proper staffing and stuff like that.
One thing I would add too is that currently there is a fee charged for the satellite location, and statute allows us to charge a fee for satellite locations. That fee goes into, commissioners, and you look at your detailed budget, the motor vehicle fund, it goes into that and other motor vehicle fees. I want to make it very clear for anyone who's listening, motor vehicle operations do not pay for themselves. And so a significant part of the treasurer's staff is absorbed and borne by property tax dollars in the general fund. We could look at changing though that fee structure, because right now I think sometimes we think it might be, you know, there are folks that know that if they go to that location, they're going to pay an extra charge. If we were trying to drive traffic to that location, because we've made it bigger and more accessible and easy and more staff, we could look at changing that fee structure to make it less, or I don't know if we can incentivize, but we could certainly not disincentivize, for my double negative there, folks from attending that location. It would have an impact on fees. But I think that's traffic flow is mostly, I think, the concern both for the treasurer and his team and myself, just trying to manage that traffic flow and getting people out and efficiently. Also trying to find a location that's more accessible, better parking closer to the door and for folks to come into. And right now we, you know, I just feel like a lot of that traffic is driven to downtown because of that.
I guess kind of touch on a couple of Sarah's points, you know, the accessibility. You know, I don't know if you've been here, but just coming up earlier, there's people waiting on the stairs. So I think we want to get away from that, find a space that allows people to wait, to sit down if they need to, and have, you know, kind of an efficient check-in point where right now you actually have to go into the office, check in, and then you can come back out. So just kind of make things a little bit more efficient and have a better waiting space for customers.
This is Commissioner Reed. This is just pure curiosity, and maybe it's for a future presentation when you get closer to the kind of nuts and bolts of what this new site, where it will be, et cetera. I'm just curious if you've seen with the ICANN website, which I don't really remember how long that's been an option. But I'm just wondering, are you seeing numbers of in-person customers driven down at all, or has it been pretty steady? I don't doubt the need for a new space. Please know I'm not trying to question that at all. I'm just curious from more like an employee capacity standpoint. like the need to spread you all out and make it more efficient and accessible to the county and public is important. Just wondering if that's driving down.
So you kind of have two different transactions with motor vehicle. You have a renewal part, which yes, you can do online. And we saw that increase during COVID to 2020. You know, we've even continued to see that increase, but you also have in-person transactions, such as new purchases. So you have to bring your title in, you have to register it for the first time here in office. So yes, renewals did go down, but also people have not stopped buying cars. So whether they're brand new cars or old vehicles, those individuals still have to come into the office and process those transactions. So it's kind of yes, it did go down, but also the transactions that take the longest are our titles. So while we may be doing more online, our wait times are then getting longer because those renewals are the quickest, those are being done online, and all individuals in the office are titles that those will take the longest time to do.
Sarah, geez. So this was an ARPA request, but we also have a $40,000 request here that is not included in your recommended budget.
Yeah, it's a placeholder. I think
Okay.
that's really not an exact dollar amount
Okay.
for what we think the ongoing lease payment might be. So what my plan would be is, commissioners, depending on what we find, I'll have to build it into the 2023 reestimate next year.
Okay.
And then into the 2024 budget ongoing. So I didn't program in extra cost associated with it this year because I felt like it was probably small enough I could make it work next year.
Okay.
However, if you would like to add additional budget authority, glad to let you do it. But
Why, thank
I
you.
just didn't know what that number was gonna be enough yet, that I didn't wanna say, well, we put 40 in, but now it's 60, so it's 20, so what do we do? And we are currently there is currently a payment for 31st Street. It's like 15,000 a year-ish, I think, right? 20. So it just depends on, what would be that number associated with it.
Okay, thanks.
Thanks, Adam. Thanks, Jessica. Good to see you. Commissioners, that's all I have for you today. We start tomorrow morning. Bright and early at 9 a.m. And I think we're gonna start with the district attorney and perhaps KHD. District Court's got some appointment, so it just depends on what time District Court's able to come over and get started, so. Anything, commissioners, you need from us today? Cool, thank you.